All right, we'll let folks trickle in here. Give it a couple more seconds while folks are hopping on. All right, let's go ahead and get started. So, hi everyone. Thanks so much for joining us today. Welcome to the third and final webinar of the series hosted by the Tahoe-Central Sierra Initiative, or TCSI. My name is Amanda Milici, and I am TCSI's Outreach and Capacity Building Associate. And we also have with us today Katie Pofall with the Nature Conservancy, who'll be posting information in the chat, and our speaker, Dr. Claire Schollaert from the University of Washington's School of Public Health. So thanks so much, Katie and Claire, for being here. So TCSI Partners designed this webinar series to share TCSI's science-based tools, products, and research that can be used to guide restoration and forest management practices in the Tahoe-Central Sierra region and across California. Funding for this project has been provided in part by the California Tahoe Conservancy. And for those who don't know, the Tahoe-Central Sierra Initiative is a partnership dedicated to restoring resilience to 2.4 million acres of Sierra Nevada forests and watersheds. Founded in 2017 by federal, state, and nonprofit partners, the initiative focuses on developing and demonstrating innovative planning, investment, and management tools. PCSI's research and tools underpin a shared restoration strategy across all land ownerships and can be applied throughout the state. So you can learn more about TCSI's work on our brand new website. It's www.tahoecentralsierra.org, and Katie will be posting that in the chat soon. So today's webinar will cover a case study on the smoke and health impacts of prescribed fire and wildfire. As we all know, both prescribed fires and wildfires produce smoke that can impact communities, but they may not be to the same degree. So we're going to hear from Dr. Claire Schollaert about her new research looking into the impacts of smoke on vulnerable populations. Claire will discuss an analysis of risks associated with prescribed fire and wildfires and provide guidance for land managers on how to minimize impacts to communities. So again, this is the third webinar of a three-part series. Our last two webinars, which covered defining resilience in California's forests and integrating climate modeling into forest management, they've both been recorded and will be uploaded to our website, tahoecentralsierra.org, within a couple weeks. So please feel free to direct any questions to the Q&A feature, and we'll either answer them throughout the presentation or save them for the end. And with that, I'll go ahead and turn things over to Claire.
Awesome. Okay, let me just share screen. Does that look, can I just get a thumbs up that that looks how it's supposed to look? Great. Okay. Wonderful. Well, thanks so much for having me. As Amanda said, my name is Claire, and I recently completed my PhD in the Environmental Health Department in the University of Washington School of Public Health. And the project that I'm going to share today made up a pretty significant portion of my dissertation work at the University of Washington. I'm really excited to round out this three-part webinar series, which has so far covered how we work towards forest resilience in the Central Sierra through management and in the face of climate change. And my focus in all this is really, the downstream impacts of some of those resilience efforts and thinking about ways that we can form linkages between forest management and the public health sectors, particularly when thinking about what impacts forest management activities will have on wildfire behavior and smoke impacts in surrounding communities. So throughout this webinar, I'm really going to hone in on the relationship between forest management activities on the landscape and wildfire and what smoke exposure and public health trade-offs come along with some of those efforts. But before we get into that, I really just want to first touch on what we're worried about from a public health and really a health equity perspective when thinking about wildfire smoke. Many of you may be familiar with some of these health effects, perhaps through public health messaging campaigns that are becoming more prevalent from local public health and clean air agencies during wildfire smoke events. So when we're thinking about the health effects of smoke exposure, we're largely thinking about wildfire smoke or total smoke, since there's been pretty limited work done on the health effects of exposure to other sources of biomass burning, like prescribed fire and agricultural burn smoke. Most health studies to date have focused on acute exposure, so on the order of a day to a few days. And so from the wildfire smoke health literature, we know that there's pretty strong evidence of the relationship between smoke exposure and all-cause mortality, as well as respiratory-related mortality and morbidities, such as asthma and COPD. We also expect an association between cardiovascular disease and smoke exposure because there's really strong evidence from the general air pollution and health literature. So air pollution from traffic or energy production, for example. However, results from the wildfire smoke specific studies and cardiovascular disease have actually been somewhat mixed to this point. There have been studies documenting associations between smoke exposure and birth outcomes, such as preterm birth and low birth weight, as well as some interesting recent work examining the impact of smoke and mental health outcomes. And I'll note that the vast majority of these studies have quantified the relationship between smoke-related fine particulate matter, or PM2.5, which are particles between 0.1 and 2.5 microns in diameter. And so this is sort of the classic PM2.5 diagram that we often use to demonstrate how small we're actually talking, where we see these PM2.5 particles in pink, these pink spheres, relative to the size of a human hair, for example, or a grain of sand. And we focus on PM2.5 specifically because they make up the vast majority of the particle mass of smoke emissions, and due to their very small size, can travel fairly deep within your respiratory tract and diffuse through your lung tissue into your bloodstream, leading to several of these outcomes that I just described. There are a number of groups that may be at increased risk because they're more likely to be exposed. So this could be outdoor agricultural worker or outdoor workers, such as agricultural workers, who are a group that I'll talk more about in depth later. Low-income communities and unhoused individuals may be more likely to be exposed, and then possible susceptible populations, or those who are more likely to develop adverse health impacts as a result of being exposed, could include elderly individuals, pregnant people, and people with pre-existing conditions like asthma and COPD. And this could also include different race and ethnicity groups, particularly Black communities, Indigenous communities, and people of color, who we know already experience disproportionately high exposures to other sources of air pollution, but may also be more susceptible to those health impacts due to higher rates of some pre-existing conditions and decreased access to exposure reduction measures. So these are really all populations that may be disproportionately impacted by smoke, and therefore may warrant increased public health protections. So given what we know about the health effects of smoke exposure and the potential for some environmental justice concerns, and thinking about possible exposure disparities among some of these more at-risk groups, there's this growing interest in the role that forest management can play in reducing wildfire smoke-related exposure and health impacts, which also bring with it this potential trade-off that stems from smoke emissions from the fuel treatments themselves, thinking specifically about prescribed burning. And so this satellite image really highlights the root of this sticking point, where we see this smoke plume stemming from the Bone Mountain Fire, which was a prescribed fire lit in Oregon in 2014 to clear logging debris. So a beneficial management activity resulting in potentially hazardous smoke emissions. And this diagram sort of depicts where this conflict lies, where the fields of public health and forest management do share this common goal, which is to reduce the adverse impacts of extreme wildfire events. But the specific public health priorities within that are to reduce exposures to smoke in order to ultimately reduce the occurrence of bad health outcomes associated with that smoke exposure, particularly among vulnerable populations. And then on the other side, on the forest management priorities tend to be more focused on achieving restoration goals, working towards more natural fire return intervals. And the forest management and ecology communities know that the most efficient way to do this should probably involve the strategic reintroduction of fire onto that landscape. And now this is where these fields seemingly diverge, in that there's this perception that these two priorities are somehow not compatible, and that despite this common goal, it is the use of prescribed burning to achieve forest management goals that appears to sometimes be at odds with the need to reduce harmful smoke exposures. And I'll just say that this is a fairly challenging intersection, but one that has sparked a lot of really interesting collaborations, which is what has looped me into some of the wonderful work of the TCSI in recent years. So with this sticking point in mind, a working group was formed under the Science for Nature and Peoples Partnership, which is a funding mechanism under the Nature Conservancy, the Wildlife Conservation Society, and NCEAS. And this QR code here will take you to our specific working group page. But this group brought together researchers and practitioners from the public health and forest and fire management sectors to think about ways that we can work together. Multiple products came out of this working group, but the one that I'm going to talk about today is this health impact assessment, where we are interested in calculating the air quality and health impacts of various resilience-focused forest management scenarios that were designed specifically for the TCSI landscape. So we're going to zoom in on this area of the Central Sierras right around Tahoe, most of you are very familiar with, where 6 forest management scenarios were developed for 970,000 hectares, around 2.5 million acres by the TCSI. These scenarios were developed a few years back as a way to holistically understand the impact the different management strategies would have on this landscape and on surrounding communities. So for context, these were developed a few years ago, and progress has since been made in implementing some version of one of these middle tier scenarios in recent years. But I'm going to talk about the process of how air quality and health impacts were used to evaluate these scenarios as a way to incorporate some of these public health considerations into this process. So the figure on the right is showing the breakdown of the varying amounts of area treated for each treatment type under each scenario. So the y-axis is showing hectares treated per year, and the different colors are showing different treatment type. So the yellow is prescribed burning, the dark green is hand thinning, and the lighter green is mechanical thinning. And you'll notice that under those first 2 scenarios that don't include any use of prescribed burning, and that the first 2 scenarios don't include the use of any prescribed burning. And you'll also notice that the second BAU, or business as usual scenario, is our scenario that most closely resembles what treatment had looked like on this landscape prior to the scenario development process. And then generally, as the amount of treatment increases, or generally the amount of treatment increases as you move up through these scenarios from left to right. And I'll also just note that I have these numbers under each of the scenario names here, just in case anyone was tuned into the scenario development process a few years back, because these were the original numerical names associated with each of these scenarios. We changed those names a bit to be a bit more descriptive for a broader audience, including public health folks, for example, who may be a bit less familiar with these fuel treatment strategies. And I'll pause for just a second to see if there are any Q&A questions. I'll ask Amanda if there's any pressing questions that I should get to.
Nope, no questions in the Q&A for now.
Awesome, great. So then here's an overview of how we get from management scenarios to air quality and health outcomes. After the scenario development process, each of the treatment prescriptions goes into a landscape ecology model that spits out several outputs related to forest and fire dynamics. But of interest to the public health folks, we get out PM 2.5 emissions estimates for both wildfires and prescribed burns, as if these scenarios had been applied to the landscape from 1981 through 2020. We then take those emissions estimates, throw them into an air pollution dispersion model, which tracks air pollutants as they're transported through the atmosphere. And from that, we get estimates of population level smoke exposure, which we use to do 2 things. The first is to calculate potential health impacts of each of these different land management scenarios. And 2, to estimate the smoke impacts among outdoor agricultural workers as a population that may be at increased risk. Okay, so these are the types of data that we get from this air pollution modeling exercise, where we're tracking particles as they're emitted from both wildfires and prescribed fires simulated by the landscape ecology model. These are maps showing PM 2.5 concentrations averaged over our 40-year study period, and this is PM 2.5 from all smoke, so smoke from both wildfires and prescribed burns combined in this case. And as the colors get darker, concentrations get higher, and we have the TCSI boundary here outlined in black. And generally what we see on average is a wider smoke footprint under the minimal management and the business as usual scenario. So these first 2 scenarios, which are entirely driven by wildfire smoke because there's no prescribed burning allowed in either of those scenarios. As we start to add prescribed burning to the landscape under the fire, light, and fire scenarios, that smoke footprint decreases a good bit. And then we start to see average concentrations go up again as we add more prescribed burning to the landscape under these upper tier scenarios. So these numbers on the bottom left of each of these maps are population-weighted PM2.5 concentrations, which are useful because they give more weight to smoke concentrations where people actually live. So when we look at those, we see the highest average population-weighted total smoke concentrations under this minimal management scenario. That number goes down as you start to add more fuel treatments to the landscape, and then we see the slight increase again in these upper tier scenarios with the maximum amount of prescribed burning applied. Now looking at this plot, these are average monthly wildfire smoke specific PM2.5 concentrations. So with the maps before, we were looking at wildfires and prescribed burns together, and here we're looking at wildfire smoke specific PM2.5 concentrations. So this allows us to see what these scenarios are doing to our wildfire season. And it's good to point out that these concentrations may seem low, but they're aggregated across the full 40-year study period and across the full study area. So they're masking those peak smoke events, but are useful for looking at trends. So at a high level, we're seeing a shorter, less intense smoke season under scenarios that include the use of prescribed burning relative to these top two lines, which are the minimal management and the business as usual scenarios. The next thing we've done is to calculate the number of smoke waves that may result under each of these scenarios. So we've defined a smoke wave as at least 2 consecutive days with PM2.5 of at least 12 micrograms per meter cubed, which is the cutoff of the EPA's air quality index or AQI categories between good to moderate air quality. Most of you are likely familiar with the AQI as the number that you see when you open the weather app on your phone, and it gives you some indication of the air quality in your area. It was developed by the EPA as a tool to communicate risk and exposure reduction guidance. And these categories on the bottom right are associated with ranges of PM2.5 concentrations. So these maps are of the average number of smoke wave days per year across each scenario. So again, we see the TCSI outlined in black here. And just from this smoke wave metric, we find that as the amount of prescribed burning increases, we actually see more of these smoke waves popping up based on this smoke wave definition that we've created, particularly right around the TCSI, because this is where more of these fuel treatments occur. But when we look at the magnitude of those smoke wave events, so looking at the actual smoke concentrations associated with those events, we see a bit more nuanced of a story. So this plot in the middle is showing the average number of smoke wave days on the y-axis or the vertical axis, aggregated across the full region impacted by smoke from this area. And then on the x-axis or the horizontal axis is the magnitude or how bad these smoke events are from a smoke concentration perspective. And what we see is that, yes, the fire plus plus scenario, which is our most extreme fuel treatment scenario, does have the greatest number of smoke days, but the magnitude of those smoke days is lower compared to all other scenarios. So there are certainly smoke wave events happening based on the definition we've created, but maybe they're not as bad. And as we move to some of those middle tier scenarios where prescribed burning is applied to the landscape, but not as much as in the most extreme case, the number of smoke waves does go down, but the magnitude of those increases a bit. And then we look at the two scenarios with the least amount of treatment, the number of smoke wave days starts to go back up, and they're worse in magnitude because those are driven by more severe wildfire events and not driven by prescribed burns. So we're seeing this interesting possible sweet spot in the middle. Next up, as I mentioned, we were interested in looking at the impacts that smoke from each of these scenarios might have on human health. So to do that, we've decided to focus on asthma impacts specifically. We know that wildfire smoke can trigger asthma symptoms, and we see fairly consistent results across geographies and populations when we look at the epidemiological studies. So we figured that looking at asthma first would be best in terms of limiting uncertainties that may exist due to differences across populations and locations and things like that. So to do these sorts of health impact calculations, we've adopted this tool that the EPA has developed called BenMap. I have the equation up here, which you really don't need to know the details of, but generally, to get these health impact calculations to work, what we need are baseline asthma rates from the area we're interested in. So we have those from the California State Department of Health. We need a change in air quality across scenarios, which we can calculate from the PM2.5 data we've generated. We need some population data, which we just get from the US Census. And then we need this effect estimate, which is just a number that links your air pollution exposure to your asthma data. And we get that from existing studies of the impacts of wildfire smoke on asthma. So for that, we've borrowed from this study that combines the results of a bunch of different epidemiological studies to come up with a meta-analysis of asthma impacts. So in this case, we're using a relative risk estimate from this study, which is just a ratio of the probability of getting a disease if exposed to smoke versus the probability of getting a disease if not exposed to smoke. So here we're interested in relative risk estimates for asthma-related hospitalizations and asthma-related emergency department visits. So these are two different outcomes that are tracked by California's State Department of Health. An emergency department visits means that someone walks into an ER to get checked out because of an asthma episode, and a hospitalization is a bit more serious when someone's actually admitted into the hospital because they were having a severe asthma episode. So we did all of these calculations using this equation and using the business as usual scenario as our comparison group. So all these health impacts are changes relative to what we would expect to see under business as usual. So these two plots are showing the difference in asthma-related hospitalizations on the left and asthma-related emergency department visits on the right that we might expect to see under each of these scenarios relative to business as usual. We have our scenarios on the left here, and the estimated change in each outcome on the bottom axis. So to the left of the dotted line on each of these plots are negative change, and to the right of the dotted line on each of these plots is positive change. So when we look at the top row, we see that under minimal management, if we do even less than business as usual, we may expect to see about 75 additional hospitalizations and about 600 additional emergency department visits due to asthma episodes across California per year. On the flip side, if we do any additional management above business as usual, we actually see decreases in these asthma outcomes across the board. So take the fire scenario, for example, a middle tier option. Under this scenario, we may expect to see over 25 fewer asthma-related hospitalizations and almost 400 fewer emergency department visits per year across the state compared to business as usual. So this is pointing to a really interesting potential health co-benefit as a result of the implementation of more management on the landscape. Now here, we've just broken down these estimates across space. So these are now broken down by county in California. So on this top row, we have the change in rate of asthma-related hospitalizations per 10,000 residents relative to business as usual. The purple colors are increases and the greens are decreases. So again, we see that if we do even less management than business as usual, we see increases in hospitalizations across these counties in the middle part of the state that even extend down to the Bay Area. And then as we add more management to the landscape, we see these reductions in asthma-related hospitalizations in green, with the greatest benefit in terms of the spatial extent of this impact under these middle tier management scenarios. And then that benefit starts to taper off a bit under these upper tier scenarios. And we actually start to see a slight increase again under the most extreme management scenario, particularly up in Butte County, which is highlighted in purple in that last column. We see a similar story on this bottom row where we're looking at asthma-related emergency department visits again, so I won't go panel by panel here. But at a high level, we think this information could be really useful because one, it points to some potential health co-benefits of these different management scenarios. And two, it also helps us to start to understand who actually may be experiencing these impacts the most. And so I'll pause just for another second to see if there's any questions in the Q&A, Amanda.
Nope, no questions, but I did just have a quick comment. I mean, I think it's really interesting how you looked at counties outside of the Sierra, because I mean, it's just showing the impact that it has for the rest of parts of the state. So that's really interesting, but no questions.
Yeah, absolutely. I mean, that's a great observation and something when considering some of the outcomes, looking at these different forest management scenarios, smoke is a fairly spatially disparate problem. And treatments and fires in the TCSI specifically can have impacts tens to hundreds to sometimes thousands of miles away, for better or for worse. So that's a great observation. Okay, moving on then, and moving on from health impacts among the general population, we were also interested in exposure among outdoor agricultural workers as a population that's likely at increased risk due to more time spent outside during work shifts, increased labor demands of their work, which can contribute to higher inhalation rates, so more smoke inhaled during a shift. And we know that outdoor agricultural workers are often of lower socioeconomic status, have reduced access to healthcare, and also higher rates of some pre-existing conditions, which are all factors that can increase vulnerability to wildfire smoke exposure impacts. California's agricultural industry employs over 400,000 workers per year, provides over 3/4 of the fruit and nuts and over 1/3 of the vegetables that we consume across the US, and as of 2021, generated about $22.5 billion. The map on the right is showing the average annual employment by county using data from the Bureau of Labor Statistics quarterly census of employment and wages for crop production employment. And I have the TCSI outlined here in red. And you can see that generally the greatest number of jobs are sort of clustered within counties that make up the Central Valley, of course. And then Monterey on the coast is also a county with high ag employment as well. So California has recognized that wildland fires pose a threat to outdoor workers, so much so that they've established a permanent wildfire smoke rule that requires employers to implement various exposure reduction measures, such as mass distribution or scheduling changes, for example, at 2 different AQI thresholds, 151 being the lower one and 500 being the upper threshold. So given the sizable worker population in this area of the state that we've seen may be impacted by smoke from the implementation of these forest management scenarios within the TCSI, as we know from the results I just presented, we are interested in calculating exposure levels for this population in particular and in relation to this workplace protection rule for outdoor workers. So we took our air pollution data, aggregated them to the county, and then linked those data to crop production employment counts from the Bureau of Labor Statistics. So these plots are showing each of the management scenarios across the bottom, and then average annual employment weighted PM2.5 concentrations on the y-axis by fire type. So these are smoke concentrations that we've weighted by areas with greater worker populations. So on the right, we have total smoke PM2.5, so smoke from both wildfire and prescribed burns together that burn within the TCSI landscape. And we see these highest concentrations and the widest distribution of smoke PM2.5 concentrations under the minimal management scenario. Those concentrations start to go down under the middle tier scenarios and then start to pick up again as more management's added to the landscape. In the middle and the right plot kind of shows why that is. So the middle box plot is showing wildfire specific PM2.5 distributions under each of these scenarios, with a general decreasing trend as more treatments added to the landscape. And then on the right are prescribed burn specific PM2.5 distributions that increase as you add more prescribed burning to the landscape, as we would expect. We've also taken these concentrations and calculated the number of worker days that would be impacted under each of these 2 AQI thresholds established by California's smoke rule for outdoor workers. So worker days here are just employment counts multiplied by the number of days that county level total smoke concentrations met or exceeded each of these AQI thresholds. So on this top row, we have the number of worker days per year per county at this lower AQI 151 threshold. And you'll see a similar pattern to what we've seen previously, where the greatest number of worker days impacted occurs under the 2 scenarios that don't include any prescribed burning, so the minimal management and the business as usual scenario. And the number of worker days are lowest under these middle tier options, and then start to pick up again, particularly in counties directly surrounding the TCSI, which is outlined in blue, as more prescribed burning is added to the landscape. The bottom row is showing the number of worker days impacted by the upper AQI 500 threshold, where we see a similar trend, but the number of worker days actually does not increase as more prescribed burning is added to the landscape under these upper tier scenarios, likely because the magnitude of smoke exposure stemming from prescribed burns are lower relative to those from wildfire, as we would expect. And so finally, here we're looking at monthly statewide worker impacts under each of these smoke rule thresholds. This top plot is looking at that lower AQI 151 threshold, with the shading representing the standard deviation of the monthly estimates, with the most exceedances under all scenarios happening during this August through November wildfire smoke season, with generally lower monthly worker days impacted under the scenarios with more fuel treatments. And then this lower panel shows the upper AQI rule threshold with a much smaller y-axis, as you'll notice, given that much fewer days reach these higher concentrations, as we would hope for. But we see that the minimal management scenario generally results in more monthly worker days impacted relative to all other scenarios, which include more treatment, which makes sense, particularly these higher concentration thresholds that are not often met by these prescribed burn events. So there are definitely some strengths and limitations to this type of analysis. One major strength is that we're evaluating fairly detailed fuel treatment scenarios for the specific landscape. I did not go into great detail about the scenarios themselves, but treatment prescriptions were designed specifically to target different land ownership types at different rates. So this goes beyond just saying what would happen if we were to uniformly increase prescribed burning across the state at X rate, for example, which is something that had been done in previous studies. Another strength in our health impact assessment is our use of wildfire smoke specific exposure response functions instead of those from the general air pollution literature. There's been some recent work showing that PM 2.5 from wildfire smoke may actually be more toxic than PM 2.5 from other sources like traffic or energy production. We've also greatly benefited from an interdisciplinary team that really allowed for this approach that links methods and models across disciplines, which is certainly a huge advance in this effort to find common ground between the public health and forest and fire management communities. There are, of course, some limitations to this work. As you would expect, these results are only as good as the models we use to generate them. Probably some of you have heard the phrase that, all models are wrong, but some are useful. We did not consider the impacts of climate change in this specific analysis, which is a key factor here and something that's not captured in this sort of historical approach. We also did not consider other sources of air pollution. So many people in this region are likely exposed to PM 2.5 from other sources, including things like traffic-related air pollution and smoke from fires outside of the TCSI, which may impact overall exposure levels and health impacts that we calculated here. Wildfire smoke is also known to cause a range of health impacts, as I mentioned earlier, and we only looked at asthma here, so that's something that should probably be explored in future work. And finally, there's some notable limitations to the Bureau of Labor Statistics employment data to characterize outdoor worker populations, specifically that those data do not account for unpaid family workers, self-employed workers, or undocumented workers, which may lead to an undercount. So that's something that should certainly be taken into account when thinking about and contextualizing these results. Despite these limitations, some things we learned from this analysis are that moderate amounts of prescribed burning in terms of just the scenarios that were looked at here can contribute to both exposure reduction and possible health co-benefits. Among the scenarios looked at here, we also saw that increasing the amount of prescribed burns called for under the most extreme options could sometimes cause the magnitude of that benefit to taper off a bit, which really highlights the need to continue to consider trade-offs. I think one exciting thing here is the potential utility for practitioners, both from a public health and the forest and fire management sectors. Health and air quality are only two of several factors that were used to evaluate these scenarios, but there are two that are not often included in these sorts of decision-making processes. So we hope that this framework that we've come up with sort of presents a path forward for how to do so in the future. And finally, I think this type of analysis can be really useful in informing some targeted collaborations with local health agencies or local air districts who oversee the communities that we've identified may be most impacted by some of these smoke events, regardless of fire source, and sort of stimulate conversation that can ideally lead to the best of both worlds, where managers can get the treatments done that they need to get done, and local health official contacts can be informed ahead of time to do what they do best, which is target public health interventions that protect communities from whatever smoke may be coming. And I'll close with emphasizing the importance of this exercise and transdisciplinary communication and collaboration in this context. I mentioned earlier that conversations around smoke trade-offs associated with forest management at moments have put public health and the forest management communities in seeming opposition, when in reality, we're really working towards common objectives. And the more that we can continue to try to learn each other's languages and share knowledge, the easier it's going to be to get more field treatments done on the landscape, while also protecting those most at risk from this complex smoke exposure landscape that we're all living in. So with that, I think I'll stop here and just acknowledge the fantastic project team that helped make this all happen. Acknowledge our funders, of course, and I'm happy to take any questions.
Great. Thanks so much, Claire. That was really, really interesting. I was like over here taking notes myself. We do have a question. So the question is, I live in Nevada City and I would like them to change their no smoke policy to allow for health and safety prescribed burning on some of the larger and steeper properties as part of other wildfire mitigation projects. Do you have any advice for how a small jurisdiction can think about this smoke effect analysis, since a local burn will have a possibly larger impact on the local lungs? Tragedy of the commons by an inverse mechanism, question mark?
Yeah, this is a great question. And something Katie and Amanda and I were actually kind of talking about earlier before we hopped on the call. And I'm sitting up in Seattle. A lot of the people who I chat with are Washington burners and local health agencies, so I can maybe speak from that experience. But what we've heard from chatting with a lot of these local level practitioners, whether they be clean air agencies, local health agencies, or burners, is that they feel like they don't have contacts in the other sectors, direct contacts at the local level to be able to talk to and work together. So they feel like there's a lot of red tape to getting management activities done, for example, and they don't know how to get beyond that. And what we've found has worked well, or we've made a few steps here in Washington, is creating spaces for some of these local practitioners to get together in a room and talk to each other, learn from each other, and at least exchange contact information. Because I think one way to this question to sort of make progress towards getting some of these fuel treatments done that obviously need to happen is having direct contact with your local clean air agency, who's going to be the party responsible for prepping the public for that to happen. And in my perfect world, if those direct connections exist, then whether that's on a yearly, a monthly, or like a couple weeks in advance sort of notice, those contacts can be working together to prep, say, your local health agency to ramp up communications campaigns, ramp up clean air shelters, if that's something that happens in that community, to sort of build those connections and get around some of those air quality barriers and public risk perception barriers that may be blocking some of those treatments from happening. So I do think one of the biggest gaps here that we need to work towards in the future is making some of those local level practitioner connections. At least in Washington, that's something we've heard has been a gap and a need.
Yeah, that's a really great point. And I think to your point earlier, making those connections, but also sharing information, like sharing this kind of research with local health practitioners and vice versa, local health practitioner research being shared with, the forest management sector is really important. So I guess a follow-up question. So since the impact of prescribed fire is more predictable than wildfire, are there other ways for fire managers or communities to reduce impacts to workers or other vulnerable populations? I know burn day regulations are one way, but they can be restrictive. Are there other methods?
Yeah, absolutely. I think some of the key thing here for prescribed burns and agricultural burns, for that matter, is that these are often planned events. And I know that, the go, no go decisions are often you only get a couple days notice, or you learn morning of that you have, meteorological conditions that allow a burner to get something done that they need to get done. So that advance notice can be challenging. But I think sort of going off of what I was just talking about, advanced collaboration, whether it's annually or monthly collaboration between some of your local health districts and your management agencies, may be key here. So something that can happen is, forest managers are planning well in advance, regardless of whether they know that they can get a certain number of acres done on a certain day. They're thinking about objectives for a season or for a year or for a multi-year period. And in my opinion, it would be great to get some of the public health folks involved with that planning early on, because what can then happen is these public health agencies are also dealing with annual budgets. And if they know in advance that a certain region of their community may be impacted by smoke from some planned management activities, they can budget for extra masks, they can budget for opening of clean air shelters or air purifiers to certain vulnerable portions of their communities. And the more that they can plan some of those exposure reduction methods, I think the more cohesive some of these management activities may be going forward in terms of kind of reducing some of that friction with air quality concerns and public health concerns. And I also just wanted to I posted in the chat a document about a workshop that was held in Washington as an example of kind of a space where a colleague of mine was able to kind of coordinate, facilitate a discussion and get local practitioners in Washington specifically in a room together. And that we've got a lot of positive feedback from that specific workshop. So yeah.
Great, thanks. We have a follow-up from the question earlier as well. So they said, thank you, very helpful answer. I'm primarily wondering about how to communicate about the trade-off between a locally generated impact versus a sort of nebulous 40-year analysis of cumulative impact that 2 local burns would probably not mitigate in any way.
Yeah, that's a great point. And, for the purposes of a presentation like this, it's sometimes easier to show things on aggregate, averaging things over a 40-year period, which really masks some of the, short-term, a day or so smoke events that are happening from individual treatments that are carried out. And one thing that we can do with the data that we've generated is, dive into some of those day-to-day smoke events and see what's happening in that shorter time scale. It's just not something I showed here. That said, these are all sort of hypothetical fires based on this modeling exercise to kind of tease out what would happen under any of these given scenarios. But in sort of a more real world application, there are plenty of fairly simple air pollution modeling tools that some forest managers are familiar with, local health or air agencies are usually fairly familiar with, to sort of tease out if you're planning a burn in a specific locality. You can put in information about your burn, and based on certain meteorology that you plug and play, see what your anticipated smoke impact would be. The Blue Sky framework that's hosted by the Forest Service is an example of, one way that you can sort of play out what the potential smoke impact may be from specific fire events. But the person who asked the question kind of hit the nail on the head in that wildfires and prescribed burns are really episodic exposure events from a smoke perspective. And when we think about the air pollution and health literature more broadly, historically, we're talking about traffic-related air pollution from energy production and things like that, which are much more chronic, daily, long-term exposure trends. And we've really had to, as public health researchers, shift our methods to sort of think about what are the implications of these really episodic events. So we're kind of growing our methods along with that, but there are some really awesome tools out there for managers that are really plug and play in terms of planning out burns, estimating emissions and downstream impacts.
Sorry, would you mind saying those tools one more time?
The Blue Sky framework, I think,
Blue Sky framework. Okay. Great, that's really helpful. And I also wanted to just point out anecdotally too that I live here in the Tahoe Basin, and from a public perspective, the Tahoe Fire and Fuels team has a really great tool on the Tahoe Living with Fire website where they show spatially forest management projects that are happening in the area, and there's a prescribed, they show prescribed fires on the map, and obviously there's like a window that it shows, and those fires don't always happen within those windows based off of conditions, but it is helpful as a member of the public to like go on and look and kind of get an idea of when maybe I should like reduce my outside exposure, because I have asthma, and it's particulate induced asthma, and so I'm one of those populations that has to limit my exposure during smoke events. And so that just is a tool that I've noticed that's been really helpful from a public perspective. But we do have another question here. Great presentation, very important research that's filling a knowledge gap. Do you have specific examples of how the TCSI landscape is applying or thinking of how to apply this research? And Katie, also feel free to pop in here too if you have any information as well.
Yeah, that's a great question. I think we're still kind of thinking through how to best incorporate these types of results with the other factors that were considered when working through these scenarios. I think this type of analysis is fairly new in terms of adding in some air quality considerations into some of these decision-making processes. And there might be someone on the call who's more familiar with updates regarding, scenario progress moving forward. From what I understand, one of those middle tier options, something that's I think resembles sort of that third option, is something that's been carried out on this landscape over the past several years, which, I mean, at least from the air quality perspective, is what we would say is our most optimal, but there are several other factors that obviously were also taken into account. I think one hope for the future would be to normalize this sort of exercise in some of these forest management planning activities, and thinking about how to integrate those early on into the decision-making process. Because as I said, as a landscape level, this is fairly new. And I think over the next few years, we're hoping to be able to expand some of this work to other landscape level planning efforts that are happening, and then thinking about ways to more seamlessly integrate. But I don't know, Katie, if you have any other comments on this.
Yeah, no, Claire, I think you've hit it on the head. This is an emerging area, and I think understanding what the trade-offs are for smoke impacts is our first step. And reaching out to public health officials and taking some of the tools out of your playbook that you've suggested is a great next step. And thinking through how we would do that as TCSI and as partners in this community. I also live in the basin, so I think there's some really important conversations that this can spur, and hopefully in the next couple of years we'll be able to implement some of those ideas.
Great, thank you both. Claire, another question. So, do you think this research has potential to change state and local policies? What recommendations would you have for policymakers?
That is a great question. And I think that there's hopefully a lot of movement happening in the policy space. I mean, there's been, relatively speaking, a lot of funding thrown in recent years to state and regional management planning efforts and federal planning efforts. So, I mean, the hope is that we can ramp up a lot of these fuel treatment processes throughout the region. I think I alluded to this sticking point, and that it seemed like in the past, public health and forest managers have kind of been butting heads, and we're slowly, making headway to be able to figure out ways to work collaboratively. I know that there's seemingly a good deal of red tape around when burns can happen, and the relationship between carrying out prescribed burns and abiding by the national ambient air quality standards. And I think I am not a policymaker, and it's a fairly active space right now in terms of conversations. I mean, even at the federal level between the EPA and the Forest Service, thinking about exemptions within the national ambient air quality standards and the ability to carry out prescribed burns. I don't necessarily want to state political opinions in this sense, but I do, or in this, forum, but I do think that there's a lot of space, particularly at the national level, to think about how to create more flexible air quality standards that allow for more fuel treatments to take place in a safe way. Because I think we're starting to understand the potential benefit, the downstream benefit of avoided wildfire smoke impacts. So I think we need to think, it's a fairly complex, but I think we need to think about ways to take that into account when talking about air quality regulation. That may have been a convoluted answer.
No, I think that's really helpful, and I think that's pretty representative of it's probably an emerging area in policy as well, and we'll see how the research is used on that front. But I guess just to kind of wrap us up here, one last question just to round us out. I guess you kind of touched on this and throughout the presentation and both through questions, but I noticed that throughout the presentation it seems like both from looking at the asthma piece of it and just smoke in general, there seems to be this sweet spot of prescribed fire, just purely from a public health perspective. And so I guess what's kind of the key takeaway for land managers based off of those findings?
Yeah, I think one of my as I kind of reflect on this work, one of my personal key takeaways is that these trade-offs do exist. And, you know, smoke is always going to be, probably a negative thing for public health outcomes, but a lot of the exposure impacts are avoidable. And yeah, we do see kind of that sweet spot in minimizing exposure and getting some of these fuel treatments done. But I mean, my biggest takeaway is the more we demonstrate that we can model and anticipate some of these impacts, the more forest managers can work together with the public health sector to make sure that, exposure reduction interventions are ready to go, ready to plug and play when we need them. And that means having masks stored up, having clean air shelters designated and open, and communicating clearly to the public. And the more we can do that in advance and the more that we can prepare, I think the more we'll be able to get fuel treatments done.
Great, thank you. And yeah, I think that just really speaks to what, an interdisciplinary field this is, and that there really isn't just one objective, that there's so many things to consider. Great. Well, just one last question before we wrap up here. Someone asked if we would be able to send a link to read more about the forest management scenarios, like the BAU, Firelight, Fire Plus, etc. Is that possible?
Yes, absolutely. A couple papers have come out from the forest ecology modeling team that I can send links out to. And then we have a couple papers on the work that I just presented that should be out, one by the end of the year and the other probably January. So we can send those out as well.
Okay, great. Well, yeah, Katie, maybe you and I can work on getting links to folks who attended. And also, I just wanted to remind folks to, please feel free to reach out to any of us directly. Katie just posted some emails in the chat. Great. Well, I think that is about all the time that we have for our session today. Great questions, everyone. And again, I just want to thank Claire for sharing her work with us, and for Katie for being here and organizing this, and the California Tahoe Conservancy for making this event possible with funding. Within a few weeks, you'll be able to find a copy of this recording on our new website at www.tahoe-centralsierra.org. And again, we really encourage you to reach out to us directly if you want more information, or if you want to connect about forest health issues and topics from any of the webinar series. So thank you all for attending, and thanks for everyone for the work that you all do to improve forest health in the Tahoe-Central Sierra landscape in California and beyond. And thanks again to our presenter. I learned a lot today. So yeah, appreciate you all being here. Thanks, everyone.